I am actually in the hospital today. Yet my interest is to teach you today the structures of the reproductive system in the man and in the woman. Ladies and gentlemen, this lesson is for adults. I want those who have reached puberty. Puberty is the age of sexual maturity, whereby secondary sexual characteristics develop in the man and in the woman. These examples are the breasts developing on the chest of the lady, the hair growing on the pubic area of the lady, in the armpit, and then menses. She will start having that, will be coming once every month. In the male, you will have hair grow in the pubic area and in the axillary region, the armpits. The chest is going to be broader. The voice will be deeper. It starts sounding like a man. Even if your boy is still about 12 years, 15 years, 16 years, you start hearing deep voice. The guy has reached puberty. Now, what do you need to understand about the anatomy and physiology of the reproductive system? My dear brother, the organs of the reproductive system are well arranged in a way that you have structures that are exposed externally and then the ones that are internal, both in the male and in the female. In the male, the external genital organs, what we refer to as external male genitalia. In an adult, somebody who has reached sexual mature age, you have only three structures that are exposed outside. But internally, there are 9 active structures. In the woman, it is just the opposite of this. The external female genital organs, or the external female genitalia, what we also refer to as the vulva, is having 9 very important structures externally. Outside. If she removes her pant, open her legs very well, you are going to see right from anterior, starting from below the lower abdomen, down the whole vulva till you get to near the anus. All this surface, what you can see outside, the name is vulva. My dear brothers and sisters, it's not vagina, like many think. We shall see where the vagina is. The vagina is not in the external structure or external female genital organ. It is in the internal. Now I want to talk strictly on those parts in the male. Externally, you find the 3 structures. What are they? You find mons pubis, is that whole area with hair. Then you have the penis that is hanging. You can actually see the size of a penis. And then you have a small like a saxamoto back hanging between the legs. Anybody can open his legs if he's a male. If a woman has never seen, try to get close to a man. Make friends with a man, mature man. Someday we'll show you there's a sack hanging between the legs. We call that back. We call it a scrotum. So you only see mons pubis, penis, and scrotum. That is all you have in the external genitalia of the male. But internally in the male, 9. Just see the tip of the penis. Just picture from there. You find a hole at the tip of the penis. As that hole is entering, we call it the urethra, as it's going inside deep. That's where your urine passes. And that's where the semen, during sexual intercourse, as you ejaculate, that water that comes looking like milk, we call it semen. We do not call it sperms. Because sperms will normally be found in semen. But remember, not all semen has sperms. Some ladies believe that when a man ejaculates, they see that fluid come out looking murky. They just say that, oh, the man has plenty of sperms. Those are not sperms. That is just semen. It's like a stream of water flowing in the bush or around your quarter. Not all streams have fish. It's the same like semen. That the fish inside is the sperm cells. Some men, as you see, will have sexual intercourse, ejaculate, quite all right. You see that fluid. But there might be no sperm inside. They will say that that man is suffering from azoospermia. When we are talking reproductive health, you are going to understand a lot that a man can sustain erection, the penis can erect well, and the man is stimulated, and a man can have sexual intercourse until the woman feels it and say that, no, this is my man, and give you the nice names that people will call, and sing the sweet songs that ladies will sing if their men handle them well in bed. I want to draw your attention to the fact that the penis could be erect. The man could have enough energy. The man could have sex. The man can ejaculate. And even like some of you will say, no, I don't want the pregnancy. Oh, I beg, withdraw it, remove it outside. Oh, you can actually pour it and you see that enough he has ejaculated. We need to confirm in the laboratory, just on a microscope, that we can get this secretion, this semen, and then we can check if we can find sperms inside. If you are with a man that is sexually vibrant and can sex well, but you go for long without pregnancy, we still need to check the man, because it may be very strong to have sex like that. The sperms are not in the semen. The sperms in the semen may be less than enough, what we call a low sperm count. Do we know that when we say low sperm count, this is because the number of sperms a man would have per deciliter in 1 meal? You know, it is said that when a man ejaculates once during sexual intercourse, the normal quantity ranges from 3 milliliters to 5 milliliters. That's 3 meals to 5 meals. Sometimes even 2 meals can have enough spermatozoa, sperm cells, that could still get a woman pregnant. But somebody may ejaculate once and it's 3 meals. But when you take 1 meal, you are supposed to have from 60 million spermatozoa and above. So that we will say that the man is vibrant reproductively. The sperm count is enough, it's good, it's within normal range. When it ejaculates this into the female tract, like inside the vagina, the sperms are so many in that their energy, the energy of so many of them is put together, and that energy can pull them from vagina through cervix to the womb, from the womb to the fallopian tubes, until where they meet the egg, the ovum in the woman. You will now see that this collective effort of the sperms, if they are actually many, as a man ejaculates, within 1 meal, you have from 60 million spermatozoa and above. They are able to carry themselves to where the egg is, in the fallopian tube. Now imagine that you or your man ejaculates during sexual intercourse. And then we study in the lab and notice that in 1 meal of ejaculate, you have 20 million spermatozoa, meaning 20 million sperm cells. Can you interpret that yourself? You are suffering from low sperm count. But you have millions, up to 20 million, 25 million, 30 millions, but you're finding it difficult to get a woman pregnant. This is because the number of sperms in 1 meal of your ejaculate are less than enough. This is a game of numbers. It's like political party going for presidential election. And the number that will vote matter. This is why they will tell you that this man is suffering from low sperm count, meaning that he is not producing sperms at all. He might be producing sperms, but the sperm cells per mil are less than the normal range that could carry all of them to where the egg is. Even though when they meet the egg, only one sperm cell succeeds to fertilize the egg, that ovum in the woman. That is why many will ask, oh, they say I have 15 million sperms. How come they say I'm having low sperm count? Yes, what is 15 million? When normal range should be from 60 million and above. Now there could be disease, there could be infection, there could be some problem somewhere you need to go to hospital. If they discover that you have low sperm count, it is possible that we trace the cause, treat it, and then enable your sperms, your testes to produce quality sperms. Now, let me now trace the passage through the male internal genitalia. The very first part, counting from outside through the hole to at the tip of the penis, going gradually step by step right down to the testes where sperm cells are produced. You have the very first part is the urethra. As you are following the urethra and going, the next organ you will meet there is a gland, the corpus gland, the bulbourethral gland. After that, you have the prostate gland. After the prostate gland, you find a branch of the same tube, of the same tubule, of the same duct moving down to your testes, left and right. We call that now the ejaculatory duct. After the ejaculatory duct, you have the what we call seminal vesicles. You know, there's another secretory gland there, seminal vesicle, that secretes good quantity of semen. And that semen is very rich, you know, even in food nutrients, like fructose, like glucose, like galactose. You know, there's juice there that needs to empower the sperm when sperm come. But when you pass that level, you now reach what they call vas deferens. As you pass the deferens, the vas deferens going down, you reach the epididymis, which is coiled like this. After the epididymis, you enter into the seminiferous tubules, which are coiled and end with the testes. I have named 9 parts internally in the man you do not see, but that's what's happening inside. This is why a man needs to also know that even an infection could cause a complication and even a blockage in your tube, right down at the level of the epididymis or at the vas deferens. This vas deferens is also a tube, okay, such that we can even operate. You remove that tube, tie it on both sides, cut in the middle, and do so with the other. And you can always have sexual intercourse, but you can never get a woman pregnant, meaning they are blocked from that level. Sperm cells will only come from down, from the testes, and as they are coming up, you know, secretions from the walls of this epididymis, vas deferens, secretions from the seminal vesicles will begin to add to it, and as sperms are moving up, more and more fluid is entering into them and activating them. And sperms, before they reach outside, they are very active and they are inside the fluid. Somebody will ask, this operation that they can block the tube of man, what is it called? It is called vasectomy, and it's a method of family planning. Some of you don't know that even men can go in for contraception, and one of such typical contraceptive methods is vasectomy. Just what I've described here. They can separate the tubes of the man so that sperm will never pass that level. But that man will still be able to be having sexual excitement, stimulation, erection, and still have sex well, and still ejaculate plenty of semen, because the semen these are secretions from the corpus gland, the prostate gland, the seminal vesicles, and the walls, the inner lining of the tubes, vas deferens, epididymis, all of that gather. Only sperms come from testes and come and join inside this fluid. So when you block at that level, sperm will not be able to join, but the fluid will gather. The man will still ejaculate plenty, but there is no sperm inside. So if a man has had enough children and he too have come of age, maybe from 45, 50, you can easily go in for vasectomy. It's a simple procedure. Now you can be having sexual intercourse any time of your choice, but get pregnant only when, or get a woman pregnant only. It is not possible. Not only. It's not possible. You cannot get a woman pregnant again after vasectomy. That is understanding the male reproductive system and its implication. Thank you. My name is Dr. David Ayim. Subscribe for more. Get to me through my contact 674-6054-69. In the next edition, I will be handling the female genital organs and their implication. Thank you.